Hi, I'm Dr. Stephen Vorholt. I graduated in 2013 and have joined Implant Pathway since early 2020, and I've been doing only implants since 2020 as well. So, how did I go from a normal GP to a diplomate in the American Board of Oral Implantology so quickly? And one of the main things that happened is in my private practice back in Ohio, I saw a full range of patients, GPs from 2-year-olds to 99-year-olds. After a little bit of time, I started to realize the only patients I was looking forward to were the implant surgery patients. And it took a little bit of noodling to realize that I just want to focus only on that. And the beauty of dentistry is you can niche down and decide that. And one of the organizations that really allows that is the AAID and the ABOI. And so when I joined Implant Pathway with Justin Moody, he really encouraged me and pushed me to work towards those credentials. And so in a couple of years after working at the clinic at New Horizons and with Implant Pathway, I was able to put my paperwork together and sit for the board exam and thankfully passed. So I get asked a lot, what's the most rewarding part about teaching and doing? And one of the things that Dr. Moody and I have always professed, and all the people who work at Implant Pathway, is that you really need to learn from people who are doing this at the same time. If someone hasn't practiced in several years and they're telling you how to do things, maybe take that with a big grain of salt. There's certainly things to learn still, but you want to be with someone who's up to date with all the newest techniques. And one of the things I love about teaching is I learn a lot when I teach because I get to hear about all the newest techniques. I have to stay up with the newest techniques. And some of the questions that come out of doctors who maybe haven't placed implants yet are so novel because I haven't thought of that in a long time that it makes me kind of rethink some stuff too. And so teaching works both ways. I think honestly, the people who are teaching or mentoring at a course learn just as much, if not more. So, what was the biggest mistake I might have made when I started doing implants? And honestly, it wasn't enough training one on one. I did a weekend course where I did 2 days of hands on model stuff, ordered the kit, and just kind of jumped in. And that's one way to learn, and you certainly can learn that way. But you need a really strong group of colleagues and mentors. What I wish I had done going back is taking a course that had some live surgical componentry, maybe a more of a continuum style, and then either having someone out to my office to help with those first couple of cases or going to a place like Implant Pathway and having mentorship right there in the room and really help propel, because there's a lot of things you don't know when you start that you have to either figure out or have someone that you can text, call, or have right next to you. And it would have been really nice to do some of the simple stuff with somebody right there over my shoulder. It would have really propelled me and kind of launched my implant career a little bit faster. The nice thing about the Implant Pathway Study Club, honestly, is that it's constant. There's updates all the time. There's an active community. There's posts you can even go back to. If you join now, you can scroll back through the months or years amount of posts and kind of catch up on stuff and see lots of different techniques and different surgeries. There's some live videos. There's some mini courses. There's some breakdowns and treatment planning as well. And so it's really nice to not just get the big course when you're, once a year or every 6 months, whenever you can afford to fly out somewhere and see somebody. It's nice to have that community kind of baked in just as a bookmark on your web browser. So when you join the study club, even regardless of your experience level, there are doctors who have joined with thousands of implants under their belt, and there's doctors who have had 0 implants under their belt yet. But it's a great community to kind of help you treatment plan correctly. So you might post a case and say, hey, I'm thinking about doing this, and you'll get a lot of responses, often from me and the other mentors in the group, about how we would approach a case. And on top of that, if you submit a case, you submit the CBCT medical history, I'll be able to go through the case live on the study club, and it'll be saved, for eternity, and you can rewatch it and kind of get an idea of where you should go. And hopefully that amount of confidence will help propel you into doing the surgery yourself. When you first join the study club, the first 30 days are free. You just get to poke around and make sure you like what you see and you feel the community. So one thing that I really encourage people to do is go through the checklist that we offer when you first sign up. Announce who you are, introduce us, let us know where you went to school, how many implants you placed, what courses you've taken, and then look through the sidebar. There's all sorts of topics on there, from sinus to full arch to single implants to restorative stuff. So go through those old archives and see kind of what piques your interest, and then please make some posts, start the conversation yourself. So one of the sections that's my favorite is the complications section. Complications are just going to happen. It's an everyday walk of life when you're in implant dentistry, especially the more volume you do. And so go through the complications section. I've posted complications. We've had other doctors post complications, and we've had some awesome back and forth on doctors who say, hey, I really don't know what to do here. And myself and the other mentors can come on and give them pretty practical, easy to follow steps and advice to keep the case in-house and the patient's trust with that dentist. So that's been really cool to see. So if you're on the fence about joining, one of the greatest things about it is for as little as $100 a month, you can get CE credits, you can meet a community of dentists that are like-minded, and you can get lots and lots of access to people like myself and other mentors that can help propel you and push you forward in your implant journey. So get in there, get active, and learn something. So sometimes I get this question about when to learn about implant complications. I've had people at our complications course who have literally never placed implants, which might be a little early to learn complications. And I've had doctors who have placed hundreds or thousands of implants and are just now coming to kind of get a more well-rounded view of complications. There's no wrong time to learn complications. The only wrong time is probably when they start to happen in your practice. So whether it's a textbook or a Facebook group or a study club or something like that, or a course, we should be very comfortable with at a minimum the common complications. And session 2 in Implant Pathway, we do discuss the top 10 complications you can expect. But if you want a more well-rounded, deeper view of complications, you've placed a couple implants, or you're really just not sure this is the kind of surgery you want to do and you want to know everything that's possible, the Implant Complications course is a fantastic 2-day course that really dives deep into all what you can expect to see in a GP practice. Yeah, complications management is often looked at in an emotional and a financial realm, right? And so financially, there's always that awkwardness with the dentist is who pays for what. And a lot of times as dentists, we're just the type of providers who tend to kind of bend over backwards for our patients. And so when a complication occurs, a lot of times the money comes kind of out of our pocket to fix things. So avoiding complications by itself is worth the value of the course, certainly. Some of the bigger complications you'll see might be something as simple as an open incision line. And if you don't know how to treat it in the first 10 days, it can lead to a myriad of issues that can lead ultimately to the implant failure, which, if you're like most dentists, you're going to do for free again. And that's going to cost you not only chair time, but obviously a couple $1,000s in implant componentry. Then there's bigger cases, like treatment planning cases. If we incorrectly treatment plan, let's say, an upper all-on-4, and we don't consider the patient's lip line, we might be looking at a $20,000 bill to fix it or have someone else fix it for us. Or worse, maybe have a letter from somebody asking us for more money, if you know what I mean. So avoid the complications from the get-go, know what you're doing correctly, treatment planning, and then know how to handle things that come up, and you'll save yourself the money, and the investment is worth it. The biggest issue with larger procedures like bone grafts that are replacing larger defects or sinus lifts is kind of the timidness that a lot of doctors approach it with. These procedures require large flaps. They require good visualization. They require good instrumentation. And if we're nervous or timid about it, a lot of times we don't get the results we want. And then that kind of leads to a spiral of maybe I don't want to do this, or maybe I'm not good at sinus lifts or what have you. And so mentorship and proper learning the techniques for that confidence to go into the case all the way that you should to, that's what's going to make you successful. The decision to move from what we might consider beginner to more advanced implant techniques is a nuanced one, and it honestly comes down to that doctor's probably confidence and maybe even what they're seeing in their practice. If you're a practice owner or an associate or a dentist who's seen a lot of sinus lifts and having to refer them out, it might be time to go ahead and jump into that course and learn how to do that kind of procedure. Maybe you're seeing a lot of patients with dentures in your practice and you want to learn how to do full arch implants. The decision is very nuanced in the sense that I've seen doctors go from maybe only a handful of implants to doing advanced techniques pretty quickly, but those doctors might be very surgically focused, minded. This is a passion of theirs. And then I've seen dentists who incorporate implant dentistry into their private practice as just an adjunct, as a thing they do as well, and they never jump into the advanced. And either is fine. I would say for you, it's when you start to send patients away that you wish you could keep, or if you get that itch like I got, and you want to be able to treat more patients more confidently, that's when you should look at courses. And I will tell you this one thing too. No one has ever regretted taking an advanced course too soon. That just doesn't exist. So at session 2, we limit the amount of seats for a number of reasons. But the biggest one is we want to be able to interact with the dentists who are taking the course. And what we realize is once you get over a certain limit, people start to clam up a little bit. So we really want to keep the group small enough that everyone feels very comfortable asking the questions they want. And we can go off in tangents because we have built-in time exactly for that. Also, because we're doing a lot of hands-on stuff, we want to keep the group small enough so that the mentors and the lecturers can be kind of touching everyone's case and kind of getting close one-on-one time with everybody.